Hello, I am Dr. Sudarshan Pandit. I am consultant hematologist, hemato-oncologist and bone marrow transplant physician. I am currently working as a senior hematologist, hemato-oncologist and bone marrow transplant physician in Cancer Center of America, Nashik. So allogenic stem cell transplant is a type of transplant in which we will collect the stem cells another healthy donor. So according to type of donor, we divide this allogenic stem cell transplant into three types. First, matched sibling donor transplant, in which the sibling donor, the sibling of the patient is the donor. It is known as matched sibling donor transplant. But what happens sometimes we don't find HLA matched sibling donor. So in this condition, we will do match unrelated donor transplant. So this unrelated donor is from donor registry, and we will search this HLA of the patient from this registry, and whenever we got the match, we collect this stem cell from that unknown donor and infuse this stem cell from this donor to the patient. It is known as match unrelated donor stem cell transplant. And sometimes this again unrelated donor is also not found. So what we'll do hap match stem cell transplant. It is known as haploidentical stem cell transplant. Basically, allogenic stem cell transplant we will do in relapsed refractory leukemias. So first thing is we have to control the disease. So if the patient is relapsed leukemia, the refractory leukemia, we have to control that leukemia. And after we achieve the remission status, after we document that the disease is in control, then we will take this patient for the transplant. So again, allogenic transplant, we have to select the donor, whether it is matched sibling donor, unrelated donor, or haploidentical transplant. After selecting the donor, we admit the patient, we give the conditioning chemotherapy to the patient. It lasts around 4 to 5 days. So after the conditioning chemotherapy, again simultaneously side by side, we will infuse some stimulators to the donor, and from these stimulators these stem cells which are hidden in the bone marrow will come out into the blood, and will collect this stem cell from the blood of the donor and preserve it. After giving the conditioning chemotherapy to the patient, we'll infuse this collected stem cell from the donor to the patient, and this stem cell will automatically functions and will automatically control that leukemia, the relapsed refractory leukemia. So this whole process will take around 15 to 20 days, and this 20 to 25 days is procedure. It is called as allogenic stem cell transplant. Generally, allogenic transplant we will do in case of leukemias. So in case of relapsed leukemias, we will do relapsed acute lymphoblastic leukemias, relapsed acute myeloid leukemias, we will do allogenic stem cell transplant. Again, in case of severe aplastic anemia, allogenic stem cell transplant is life-saving. Again, in a benign condition like thalassemias, sickle cell anemias, we will do allogenic stem cell transplant. Allogenic stem cell transplant is potentially the only way available for relapsed refractory leukemias. So basically, we will replace this patient's immune cells with the healthy donor's immune cells, and these donors' immune cells will automatically function and will grow and automatically control these relapsed refractory leukemias. So the benefits are like we can control and we can cure that relapsed refractory leukemias. For that, we will doing this allogenic stem cell transplant.